access quality emphasis on quality healthcare at very reasonable cost. Good morning, Lagos. Great to have you with us. My name is Akan Usen, welcoming you to an amazing time on radio. Today on the show, like every other last Monday in the month on the show, it is one-on-one with LASHMA, where we welcome your questions, your concerns, your inquiries, also your commendation. Every of this, whatever the category, it is welcome. We definitely would love to hear from you. One-on-one with LASHMA, that's our edition today. We'll definitely welcome your questions and concerns. 091 538-77127. Yes, that is the phone line. 091-538-77127. You can also send a WhatsApp message to 080-991-20777. 091-538-77127 is the number to call, and 080-991-20777 is the number to send a WhatsApp message to. All right, so straight away, we'll be introducing my guest. He's a face and a voice you definitely know if you are an ardent listener on the show. He's a sales officer with Lagos State Health Management Agency. I'm talking about none other than Mr. Soji Dosunmu. You're welcome, Mr. Dosunmu.
Good morning.
Good morning.
Good morning, Lagos. Great to be back.
Great.
In the studio of Traffic FM.
Yes, great to have you with us. And today it's all about one-on-one. I know the last time we were talking about the enrollment process. Last time we had you on the show, it was all about the enrollment process. And of course, we'll be talking about that. But it's a one-on-one with LASHMA, so definitely we'll be having questions from all corners, all angles, as regards ILERA EKO. And well, it's another great time to tell Lagos residents about ILERA EKO. Like we were talking about off air, it's a, I don't want to say it's a pity, but it's really surprising and appalling that sometimes even the so-called people who are supposed to be in the know, you throw this question to them, like, do you know about ILERA EKO? They're like, oh, what's that? You know, it is really surprising. So for people who do not know, and to also help those that perhaps know but do not have a firm grasp, let's help them have a better understanding of all this. What is ILERA EKO?
Okay, we'll want to excuse those who do not know about ILERA EKO, and like we said, you still have scores of them around, and we are not angry. And that is why we are on air, every now and then,
doing the needful
on different platforms, because we need to keep informing people and to educate those who are not in the know. For ILERA EKO, I've always maintained that for me, ILERA EKO is the peace of mind that the Lagos State government has brought on, to the residents of Lagos. The proper definition of ILERA EKO is that the government wants to save a lot of people, from the hardship, from economic hardship of having to face financial difficulties when they have medical problems, and that is what ILERA EKO really is. And it's also for people, for residents, to reduce out-of-pocket spending, even when they have to do spend. You know that having ILERA EKO in place will reduce your out-of-pocket spending, because all over the world, it's not everything that is covered by health insurance. And so when you do need,
and that happens a lot.
It happens,
when you go to hospitals, for those who are on HMOs, you'll agree with me that when you go, they will say this is not covered. This is covered.
Exactly. But definitely having an ILERA EKO scheme in place will considerably reduce your out-of-pocket spending. So that is what ILERA EKO really is. We are saying that when you have ILERA EKO, you are buying into a very considerable amount of peace of mind, because you know that with ILERA EKO in place, you can actually take you and your family to get quality Medicare around Lagos, and whatever comes, ILERA EKO is there for you, and you can always have something to follow.
great one. You can always have something to fall on. Of course, we know that you'll agree with me that nobody plans to fall ill, nobody plans to fall sick, nobody plans to be in a state of unwellness. But it's also quite comforting that you have a safety net, so to say, something to help, with the expenses when the unforeseen happens. Maybe not for you, but your loved ones out there. It will always be comforting that you have something to fall back on. Now, Mr. Dosunmu, who is eligible for this? Who is eligible for ILERA EKO?
Every resident of Lagos.
When you say every resident of Lagos, there's some people who actually spend their entire day in Lagos but live on the fringes, so to say. They might not live in Lagos, they actually might live on the outskirts of Lagos, but they spend their waking hours in Lagos. How are they also qualified to,
Yes. Yes. Well, your definition of resident in Lagos might be different from my own. But everybody that have anything to do with Lagos, maybe we should put it like that. If you spend your considerable amount of time in Lagos, you should actually take an ILERA EKO policy, because, like we said, it is something you want to do, to guide against you having to spend money when there is a need for you to get Medicare. So for everybody who lives or works in Lagos, you can actually benefit from ILERA EKO. ILERA EKO is there for you. And our slogan is leaving no one behind. Anybody that have anything to do with Lagos, you are qualified and you should actually be on ILERA EKO.
Okay. All right. A quick look at the traffic situation. Motorists, you're advised this is from the Ogolonto end. Situation report from Ogolonto end. Start movement from Arono inwards Agric is busy due to construction work ongoing at Okeria inwards Agric. And Tikeni inwards Idiroko, Ogolonto Majidun, all through to Itawolo is good. Likewise, the return journey. Motorists, you are advised to make use of the BRT corridor. That's from Ragolis towards Ogolonto. And also, a lane is available on the service lane. This is just to help ease that busy movement on that stretch. Of course, we have LASHMA traffic managers on ground, adequately monitoring the situation. Please, from this end, we're just letting you know that you can make use of that BRT corridor coming from Ragolis towards Ogolonto. A lane is also available on the service lane to ease busy movement. Traffic managers on ground for adequate monitoring, making sure things move as swiftly and as smoothly as possible. All right, we have Mr. Soji Dosunmu here, right, doing justice to the we're talking all about ILERA EKO, but of course, it's one-on-one. We really want to hear from you. We definitely would love to get your questions, your concerns, your feedback. 09153877127 is the number to call. You can also send a WhatsApp message 08099120777. All right, Mr. Dosunmu, of course, you've talked about the fact that if you live and work in Lagos, you are eligible for this. But how can Lagos residents enroll on the scheme?
Okay, for everyone listening to me right now and you want to register on the scheme, please, if it doesn't bother you, please come to the Good Shepherd House in Alausa. Directly opposite the gate of the secretariat is a 5-story building. That is where we are. That is our office. But if you cannot make that journey down to Alausa, we have our offices scattered, all over Lagos, especially our divisional offices. We have for Ikeja division, we have our Ikeja divisional office at the Ikotui Godo LCDA. Inside the LCDA, walking there, immediately you look into the left after entering the gate, you will see our office there. For our Ikorodu divisional office, the Ikorodu West local government, along the road before you get to our Greek bus stop, is where you can actually go to register. If you are in Ekpe, you go to Ekpe General Hospital, for you to actually register. And we have for Badagry Divisional Office, and we have Lagos Central Divisional Office at Aja, the Aja BRT area. that is where we have, and we also have what we call the V boots. For example, in K2 you have a V boot.
Okay.
You have in some major markets, Yaba and Sabo. Sabo, not Yaba. You have V boots, and in most of the general hospitals around Lagos, go in there, tell them you want to register for ILERA EKO. Our personnel are on ground, our kiosk are scattered in these general hospitals. You can actually get to register there. And if you are the one who like to do it online, just go to www.ilereko.gov.ng and you can actually register there.
All right.
Then you can make use of the USSD platform.
Code. Can we have that too?
Yeah, star 6700.
Star 6700.
Star 006 hash.
Star 006 hash. Okay.
And you can actually call me because I'm going to drop my number at the end of the program if you want to register.
All right. A great one. And yes,
www.lashma.com.
Lashma.com. Okay, yeah. That's the website.
Just visit it and you can.
So once we go on the website, we can also get all the information and follow the prompts.
Exactly.
Okay. One more time. Let's just have that short code, the USSD code, for those who perhaps want to go via that route.
Star 6
7
7
0
0
0
star 0 6.
So hash. Star 6700 star 006 hash. And with that we'll follow the prompts. Is it free or will we be charged?
No. It's actually a free platform.
Free service. Okay, great one. All right, so okay, I have a question. This person just sent this. David, he says okay, I'm confused about the standard JARA plan. Is it that all other plans no longer exist? Okay, can we shed light on this?
Yes, thank you, Mr. David, for that very wonderful question. Before now, we used to have the standard JARA plan. We have the senior citizen plan. We have the standard plus. Okay, all of them are no longer in existence.
Okay, they've been phased out,
they've been phased out because we needed to improve on something. Okay. The complaints around these schemes, those plans are rife. We needed to improve, and with that, we improved on it, and we brought out the standard JARA. Okay. But now, good news, you have the standard JARA Plus.
Oh, okay. That's
so for somebody like Mr. David.
Okay.
Now we have the standard JARA Plus.
So after standard JARA, we now have a standard JARA Plus.
In fact, we have taken it further. We have improved upon it further. The standard JARA is a very big improvement on what we used to have.
Okay.
But now we have the standard JARA Plus.
Okay.
And also, we have the new senior citizens plan.
Okay.
We have the new senior citizens plan. As a way of education.
So please educate us.
The standard JARA Plus. For the standard JARA, the individual premium is 15,000. But for the standard JARA Plus, the individual plan is 40,000 naira.
Okay. Why? Why is that? What's the plus in the standard JARA Plus?
Because you still have some people who say, "Oh, this is good, but we still want something that is better than this. We want something
so the argument was that a lot of people wanted more, and standard JARA was like sort of a conjugation of all
that we used to have in the past.
So what did you add? What's the plus?
Okay, a lot of things is added on the plus. A lot of added on the plus. For example, you talk about people with kidney diseases. The renal dialysis. You talk about acute and chronic kidney diseases. Now you have something that can look into it, but you don't get to enjoy it until the second year of your plan. But it is something that we know what it costs to take care of this type of illnesses. And also for the ultra scan test, Now you can obstetric scan. Everything now it is included. I mean, things that people
That's for
long
the women,
for,
obstetrics,
people ask
gynecology.
for, has been added into this standard JARA Plus. I mean, things that ordinarily, were not. Okay, for example, you talk about admission for the standard JARA plan. It used to be 15 days, but for the standard JARA Plus, 21 days.
Okay.
I mean, a massive improvement. People ask for it.
That's like 3 weeks.
Before, it used to be the general ward. Now you have the comfort of a semi-private ward.
Semi-private, okay.
And if you are in the private hospital, private wards, I mean, a lot of improvement has been added onto it. And that's why you have the standard JARA. And for eye care, for standard JARA, it used to be 10,000 naira.
10,000 naira
maximum.
Yes.
But for this, you can get your lens if your lens, is those ones that will attract up to 20,000.
Yes.
You can enjoy it on the new standard JARA Plus.
Okay. Wow, amazing stuff. Okay, so you were also talking about the pricing for the individual. You said for the standard JARA Plus.
Yes, for the individual.
As against the 15,000,
it's 15,000, and for the family of 4.
Yes.
Against 55,000.
Okay.
That one is 146,000.
All right, let's hold our thought as we take this call. Hello, good morning.
Hello, good morning, Akan.
Yes, good morning. Who are we on to?
Good morning, ILERA EKO there. My name is Babatunde. I'm speaking from Egbeda.
Good morning, sir.
Welcome.
It seems these people need to get their acts together because there's so much confusion.
Okay.
Why I said that, I was formerly on seniors plan.
Yes.
When I wanted...
Hello, Babatunde, are you there? Oh dear. Babatunde?
And I would have loved to.
I think Babatunde has called on the show before with the same complaint.
I'm not sure he's going to call again.
Yes. So Babatunde, do call back. I'd definitely love to hear from you. Let's get the full meat of your grouse. Let's hear this. Hello.
Hello, Akan. Please,
yes.
It's me calling back.
Okay, Babatunde, please go on, sir.
So they said the seniors plan is no more in existence.
Yes.
That there is standard JARA that they have to do. I said how much? They said 15. I said that's even lower than the seniors plan they are doing. So they said that I can do. So I had to do that. Now I'm listening to the radio now, and I'm hearing that
there is no
JARA Plus.
Yes.
And they have seniors plan, and they never told anybody. And for all these things, I believe if you are taking one off and you are putting a new one, you should explain specifically. Anybody coming as your customer service, you'll be able to explain to the person, this is the way what we have, and for whatever it is. If I'm living seniors plan and I want standard JARA Plus, there's nothing stopping me from paying the 40,000. Rather than telling me the seniors plan is off, so the only one that's there now is standard JARA, and I have to do that.
And you have to do that for an entire year, right?
Yes. So, and because they don't allow it to be upgraded during the year except until it expires. So that's why I said they need to get their acts together.
Well,
thank you.
Thank you very much, Mr. Babatunde.
Mr. Babatunde, please permit me to respond to you.
Yes, please do.
Thank you, sir, for your interest, in ILERA EKO, and I'm very sure you've been enjoying even the plan you are on.
Yeah. So you understand? He was on the seniors plan, and when the thing expired,
I understand everything he said.
Yes, okay.
By the time we put off the senior citizens plan, and we asked you to migrate to the standard JARA from 34,000 to 15,000, we realized that everything in the standard JARA plan, everything in the senior citizen plan has been included in the standard JARA plan. So why should we shortchange you? Why should we collect 34,000 naira from you when you can buy into a 15,000 plan that have everything as benefit into what you're going to pay 34,000 naira for? And now, LASHMA, we are ever evolving. We have people who do researches, who want to get it better. Now, several months after, our team have sat down, look at what they can do to improve, the senior citizens plan, and it has been greatly improved, especially for people at that age. Because before now, you still have people who complain that, in some private HMOs, you have something that in fact, they prefer to go and pay 150,000 naira for individual to get this. Now we have a team that has sat down, put all those things together, and you can actually have it for 60,000 naira. So it is no longer 34,000 naira for the senior citizen plan.
Okay.
It is an improved plan that is now 60,000 naira. So
for individual.
Okay. And for a couple, it is 100,000 naira. Before 100, it is 34,000 for individual
and 65,000
for a couple. Now couple is 100,000, while individual is 60,000 naira. What I'm trying to say is
what changed?
A lot of things.
Okay.
A lot of things changed. Akan. For example, we talked about the eye care.
Yes.
Which the standard, the senior citizen plan before.
Yes.
It was 10,000 naira. Now 25,000 naira.
25,000 naira. Okay.
25,000 naira, and all those what do you call it? Surgery for the eyes that was not there before has been included, because we understand that as senior citizens, they tend to have most things to do with their eyes. I mean, a lot has been improved upon this.
Let's take this call. No cataract surgery. Let's take this call. Hello, good morning.
Hello, good morning.
Yes, who are we on to?
Yeah, my name is Solomon Wokoma.
Okay, Solomon Wokoma, please go on.
And I've been listening to the program on ILERA EKO.
Yes, please.
My major challenge is this. I'm actually directing, not actually the question, it's a comment.
Okay, please.
To your guest in the studio.
Yes.
It's about when they raise the salient point. They need to put their house in order. What I expected for him to say, yes, we will do that. Nobody is saying that the plans they have, there's no improvement, there's no upgrade. No, that's not the issue. That's not what Mr. Babatude is saying. What Mr. Babatude is saying is, when these upgrades are done, at first point, either at the hospitals, the health centers, somebody should be there to be able to communicate to people straight up, on point. He shouldn't be on radio after all that has been done and the whole thing is confusing. What I expected for him is not to go over explaining those things, but to say, yes, we've noted and we'll do due diligence or do exactly what is required.
All right.
Thank you very much.
Thank you very much, Solomon. Do enjoy the rest
Thank
of
you very much, Mr. Solomon. I really appreciate your comment. Once again, we are sorry for every inconveniences. But like I said,
yes, welcome the feedback.
This came up late last week.
Okay.
Late last week.
So
I'm very sure that if you go to the hospitals, you have people there today, Monday, telling you about this, which they couldn't do last week because it was not there last week.
Yeah.
As at this time last week, it was not there. Please, I want people to understand. That is why we are on radio. Radio have more reach than you walking to the hospital.
Yes.
Now you are not in the hospital yet, but you have heard about it. So when you now go to your registration point, you can then tell them that, you heard over the radio that you have been able to improve on so thing. You have brought out a new plan. So we are sorry, like we said.
Yes.
In the process of serving you better, it just came out last week.
Yes.
And we are here telling you about it.
So definitely that's what we do. We'll keep
firstly for your ears.
Yes. That's fresh out. So we now have a new improved or two new improved plans. We now have the standard JARA Plus as against the standard JARA plan. And yes, we have the senior citizens. It's just still called the senior citizens plan, but this is sort of a new improved version. Yes. Okay. So let's just for people, for the people like who need to give feedback, who need to go even after the show. Well, how is the feedback mechanism at LASHMA? Can an enrollee give feedback about healthcare received? And how do we go about this when we need to communicate?
Okay.
Because as we can see, you agree with me that feedback is really important on both sides.
Exactly.
Communication and all that.
We have a customer care. We have customer care channels. That are there 24/7.
Okay.
We have people who sleep in the offices, to receive your call at any time of the day, and you can actually reach them on.
Okay, I think Babatunde is calling back. Let's see if we can just take his call real quick. Hello.
Hello, Akan.
Yes.
Sorry to disturb you.
No, it's fine.
The feedback you have said.
Yes.
I wish the gentleman can go back to the houses and tell them some of us are ready to pay the extra one so that we can go back on the normal plan we have. Because
for senior citizens.
Any else can come. Yes, any challenge can come to anybody within a year. So that's a long time. So part of the feedback, they should get back to the office and tell them, some people are on this plan before, they migrated them to a different plan. Now they want to get back to their new plan since you people have upgraded it and they are ready to put money. We are not saying they should give a service of 15,000 for somebody who is to pay 60,000 naira. People will be ready to pay that, but they're on the normal thing which they have, which is still a long time before. And I renewed just about a month ago now, and so that means for 11 months I have to stick to what I don't want. So that's why I said for feedback, they need to get back and tell people they can upgrade if they want, so that they can go on with the plan. Thank you.
Thank you so much. We
much,
appreciate
Mr.
this.
Levante.
Do have an amazing day. All right, Mr. Dosunmu, let's just respond to that. The program seems to have, taken a really interesting direction, though. You'll agree with me. Okay, let's. Would you want to respond to that?
No. There's nothing to respond about. The man, gave a very good feedback,
valid suggestion.
that we will take back and try to work upon. It's unfortunate that he just renewed last month. He said 1 month ago. Abi?
Yes.
Okay, it's unfortunate that it just renewed. We'll look for ways, whereby we can bring people like Mr. Babatunde, back. But the only correction I want to make is that, he has not lost something. He just wanted an improvement because him paying 50,000 for something he was paid at 4,000 for before. He hasn't lost anything.
But he really wanted to.
He really wanted, so we will see ways to give that back to him.
Okay.
So talking about feedback. So I was saying that you can actually get to the customer care channels. The 08000 ask 0800 ask LASHMA. 0800 2755
right
27462.
Okay.
At any point in time, call this number. If you remember 00 ask LASHMA or 0700 ILERA EKO or 0800 ILERA EKO, either of those three lines, 0700 ILERA EKO, 0800 ILERA EKO, 0800 ask LASHMA. These are toll-free lines. Try to make your call, give your feedback. Somebody is there waiting for you. And for lines that you have to pay, to get across, I can give you the numbers if the listeners are ready.
Yes, let's do that.
091 because most times the toll-free lines are very, very busy.
Because
people know it is toll-free. Somebody can spend 30 minutes talking to you and they are not eager to drop off, and we cannot drop them off until they are satisfied. So they are mostly busy, but if you want to quickly and you want to pay the toll paying lines, 091 691 85 920. You can call that line, or 070 402 770 29, or you can reach us on WhatsApp. If you want to chat at any point in time, just chat. The WhatsApp is there. It is not even what do you call it, machine that will respond to you. People are there waiting to respond to you 24 hours of the day. 070 45 35 8275. I take that again. 070 45 35 8275 or 070 46 16 0051. 070 46 16 0051 for WhatsApp. Anytime you chat, the people are there to respond to you.
Okay.
Like I said, I'm going to leave my own phone number.
Yes, let's have your line. Let's have your line.
You can reach to me on 081 810 10708.
Okay.
I can take that again. 081 810 10708. You have your companies. It is now a law in Lagos State that for employers of labor, you have to get your employees on ILERA EKO. Nobody wants to go against the law, so you can invite me. I will come, with our team to your office, so sensitize you, tell you, how to do about all those things, go about them. I'll tell you how to enjoy the benefits and how to register your company, your association, your mosque, your church. Call us. We will be there.
All right. It's been a great show. David just sent another question. Since we have, I think what he means is since we now have more than one plan, of course, prior to this time, we had more plans, but everything was, compared to the standard JARA plan. But he says since we have more than one plan, let your guests. Okay. So, let your guests. Okay, so I think this will not be possible today. I think he's asking that, let your guests explain each to us, but we've come to the end of the show. Time is not our friend. Well, is it possible we dedicate an episode of the show, since we now have a standard JARA plus?
Yes, I'm very sure that will be the
main focus.
Because wait, these things are designed by experts.
Yes.
Salespeople like us, we are put into training to come out there to explain it.
Yes.
The doctors, the experts know very much about it. We don't. I'm not a medical person.
Yes.
But I've been, trained, to know some of these things. Not, many of us
so
have known about it.
Can we have an edition of the show where we come talk?
Yes,
we know about the standard JARA. We know what the benefits are of the standard JARA plan. Or not well, to a great extent. I can actually talk about the standard JARA plan, but we now have a standard plus. Let people know side by side what's the standard plus. Standard JARA plus. Yes, and then the fact that we now have a reawakening, so to say, of the senior citizens plan. Okay, a new improved version. Let people know what is new about this.
We will surely do that.
It's been a great time, but before I let you go, can you just please, do a bit of a final advice, so to say, to Lagos residents concerning ILERA EKO?
Yes, thank you very much. Thank you, listeners. Like I said in my opening, ILERA EKO is here for all of us. That is what is obtainable all over the world. We don't want to be left out. You don't want to be left out. You don't want to carry the burden of your medical expenses all alone. Why don't you join us to carry it with you? We are there for you. You can actually rest on our strong shoulders. I mean, it is a very high subsidized but quality health scheme that you can rely upon. So why don't you take advantage of it? Tell the people who have not heard. Tell people in your churches, in your mosque, in your associations, all Lagos. The slogan is leaving no one behind, and you don't want to be left behind.
All right, amazing one. Thank you so much, Mr. Dosunmu. It's been a great time on the show. I really learned a lot, new information. I've gotten new information, which of course I will definitely be updating my knowledge base. Mr. Soji Dosunmu is a sales officer with the Lagos State Health Management Agency, LASHMA, and we've had an amazing time on this one-on-one with LASHMA. Thank you very much to Mr. Babatunde also for calling in, and Mr. Solomon Nwokeoma, for giving his 2 pence, so to say, of advice. And yes, we thank you to everyone who has been listening on the show, even though you didn't call, but we still say thank you. Yeah, good health, like we say, is not something you should toy with. It's always, yes, we definitely know everyone wants to stay healthy all the time, but when you fall ill, it definitely is nice to have a safety net. Get yourself on ILERA EKO and have that safety net for you and your loved ones. My name is Akan Usen, saying thank you, and of course, asking you to keep it locked on this dial always, every time, as we always give you quality value. A big thank you to Thalban right here in the studio with us. Also saying a big thank you to Adein Kagbemigbade, Assistant Director, Public Affairs, LASHMA, right there. Also, not forgetting to say thank you to Victor Terry. Shout out to Wuraola right here in the studio with us. Till we come your way again, I'd like to advise you to get on board ILERA EKO. Join the train. Bye for now.